challenges to pregnancy.
Try and engage it. You started your life already. Try and engage people that are joining.
Okay. Good afternoon, everyone. I'm Aisha by name, a fertility nurse in Clearview Hospital, and the topic for today is overcoming fertility challenges. Okay. We will be describing defining what infertility is. According to the World Health Organization, infertility can be defined as difficulty in achieving pregnancy despite uninterrupted timed intercourse within a year. So the window is at a year. After a year, then you can start seeking for other options to aid your reproductive lifestyle. Now, to discuss overcoming infertility challenges, we have various sub-headings, and we'll start with assessment. Before you can start fixing a problem, medical evaluation to know what the actual cause is. Could be male factor, could be female factor, could be a combination of both of them, and could be but there is just no known factor for the cause of the infertility. Now, for the medical evaluation, we have the semen analysis for the male. It could be a simple semen analysis, it could be MCS, microscopy and culture, to know what and sensitivity, to know if there is any further thing that should be treated on the side of the male. And for the female, we have the hormone testing. We have various reproductive hormones that may affect your ability to conceive. So when you go in to see your fertility physician, he will prescribe the screening test that will be done for you. Then we have the ovulation tracking. Now, this is still part of the medical evaluation. So the ovulation tracking is done through the hormone test to check for the LH hormone, that is the luteinizing hormone, which is supposed to be high during your ovulation, or you can do a scan to know how the follicles are growing in each phase of your cycle, and when eventually the follicle ruptures and the egg is released for timed intercourse. Now, right behind the medical evaluation, we have the lifestyle changes that you may employ to help your fertility journey. Now, part of this, we have exercise. There is nothing like too much of exercise. Consistency is the key, so exercise can help. Now, we are talking about exercise in cases where the woman may be overweight, so shedding a bit of weight may help your fertility journey. Then we have avoidance of smoking and alcohol consumption, as well as use of recreational medications. Now, we have medication as well. Now, for some people, we may just use a few prescribed medications, right, to treat the infertility. Now, the medication will be used to induce ovulation, so you may have enough numbers of the follicles growing, right? And then we have the ART, assisted reproductive technology. Now, for the assisted reproductive technology, you have different options. You have the IUI, intrauterine insemination, that you use your eggs and partner semen or donor semen. You have the IVF, that is in vitro fertilization. You have to take the eggs out of the lady's body. Then the semen is also taken out of the lady's body, and then they are brought out together into the lab, and then it's in the incubator. You culture them in the incubator for 3 to 5 days and you transfer. Then you have the option of ICSI as well. That's a little bit more advanced, but it's still part of the IVF process. Some facilities may afford you that service, while some may not. Then we have the surgery. Now, all these are methods of overcoming infertility challenges. Now, we have surgery, that is, you may have an anomaly, or you may have a growth, or you may have an anatomical dysfunction that could be repaired surgically. Now, we are looking at in the cases of cysts, in the cases of fibroids, that's where surgery may come in. Then we have the third party options. Now this is under the IVF treatment as well, in that you may use donor sperm. I mentioned that before. Then we have the donor eggs too, may be used to boost your chances of achieving pregnancy, or you may need the services of a surrogate to achieve pregnancy. Then we have alternative therapy. This is not common in this part of the world. Acupuncture, use of herbs. While herbs may be useful, studies have not shown that it will achieve the result, right? Then we have counseling. So I may dwell more on the counseling because the issue of infertility is definitely draining. And I like to believe, on the personal note, that the journey is not about the finances. Of course, it is financially draining, that's without a doubt. But then you have the emotional roller coaster through the journey. Now you are going, all hopes are high, you are here coming for your scans with your husband, for people with supportive partners, and some may not even have supportive partners, which makes the journey worse. Now, imagine no supportive partners, no finances, the journey is almost impossible. But in the case where you have all, the emotional roller coaster is still not something that can be escaped, because it's there, it's part of the journey. The hopes are up, you are there going for your treatment, and on the day of the pregnancy test, it's not something that you want, right? So now you have to start all over again, and that part of the journey may just not sit well with a lot of us. Now, you as an individual, there's nothing like, oh, it's not affecting me. You will definitely have your triggers. For some people, it could be sitting by themselves, while for some people, it may be hearing the gist from colleagues regarding their children. Or I'm going to my children's house sports competition, I'm going for this occasion with my children. It may be a trigger for them, and if you know you are in this category, I would advise you to remove yourself from such triggers and find your happy place. By your happy place, it may not necessarily be your home, could be your husband, could be a space in your head, or a moment in time when you just sit and you have pleasant memories and you just try to cheer yourself up because you are doing your best, of course, and you are not to give up until you have achieved your aim, which is carrying a baby. Then do not point fingers. It's a journey you have to take as a couple, so it's not necessary for you to be like, oh, it's my partner, my husband is the one with the low sperm count, my wife is the one with the blocked tubes. That's not necessary. It's just for you to come together as a couple and hold each other's hands through the journey, and no matter where it ends, you should have each other's back. Yes, and if you know it's beyond what you can handle, you can go ahead and seek a counselor. Now, if you can't afford a counselor, you can go with your spiritual leaders and have discussions with them. Infertility should not be the end of a marriage, I believe. There are various options, and in this part of the world, we are familiar with picking a child from another member of the family to nurse, pending when yours will come along. And I think it's a great idea, really. All right, and that's all on this week's episode of Fertility Focus from Clearview Hospital. Thank you. Okay, so if you have any question, please let me know. I'm still trying to see if there's any question for me.